I'm in my second trimester. Trimester though. Then after your tech age, is it advisable to sleep with your husband?
You tell the husband, just stay on your lane, oh, don't come close. Because we don't want anything that would. The first thing I want to say is that if you don't have any symptom, don't worry. It doesn't mean you are not pregnant. I say, doctor, I'm not even feeling pregnant at all. Are you sure I'm pregnant? Relax, be calming down. The fact that you don't have any symptoms does not mean you are not pregnant, because some patients will not have any pregnancy symptoms at all. Why some patients will have some pregnancies? But some patients have pregnancies, they don't even know they have it. When you now start asking them, okay, do you feel weak? Okay, do you sleep more? Oh yes. Your boobs, are they bigger? Tingling sensation? Oh yes. These are all part of the. Are you eating more? In fact, I'm craving some things that I don't used to crave before. All of those things are all part of early pregnancy symptoms. It's just that it varies from one woman to another. What may be your pregnancy symptoms may differ from what your pregnancy looking at, I may be wrong, but I want to assume that most people who are here, they are probably in their first trimester. If you are not in your first trimester, you have gone beyond the first semester. All right. For those of you who are in your first trimester, congratulations. Because very shortly, you will move to your second trimester, and then you move to your third trimester. But we wanted to start with the first trimester, okay? And just to talk about what the first 3 months of pregnancy is all about, because particularly for couples who have not been pregnant before, they are usually wondering, how does this pregnancy go? All right. So sorry, just a minute. Okay. So why the technical team are trying to put up the thing? It's very important for every one of us to be acquainted with how the pregnancies usually go. It's important for me to state here that every pregnancy is different, all right? And even for the same woman. So no two pregnancies are the same. So your experience in your first pregnancy may not exactly be the same with your experience in your second pregnancy. And then when you want to compare pregnancies with your colleague, with your friend, while some may have similar experiences, some may have very different experiences. And so it's usually a challenge when you're trying to ask, this is what I'm feeling. I don't know if it's normal or not, right? That's what most times is going to your mind, because I've not been pregnant before, so I can't say possible. I don't know how it feels. I know I have a wife who has gone through pregnancy, and I see with pregnant women. In fact, both of my personal life, gynecology, I've had to deal with women who are either pregnant or trying to be pregnant. I've come to understand that the feelings, the process, the experience varies among different women. All right. But what we're trying to do in this very short class is to try to explain to us visually what the process is like, what goes on when a woman is in her first trimester, all right, of pregnancy. It can go from a woman barely knowing that she's pregnant, a woman having first symptoms of pregnancy that you don't need to even know that this is not pregnant. It's sleeping all over her. Comes down with a lot of symptoms. Okay? Now, the first 3 months of pregnancy is really regarded as first 13 weeks of pregnancy. When we count in terms of weeks, we need to count in terms of months. So when we say a woman is 12 weeks, 12 weeks does not translate to actually 13 weeks of before the period. Do you understand? Because most times say, I'm already 3 months and it's 12 weeks. I said, no, you're not exactly. It's 12 weeks, not 3 months. No. So if you want to count January, count February, count, for example, the last period was on the 1st of January. January is 31 days, Abi, and it has 4 weeks and 3 days. This year, February, is how many days? 29 days, and it has
34 weeks and 1 day. And then March is what? 31. That's 4 weeks and 3 days. How many weeks is that? 13 weeks. You carry 3 from January, 1 from February, 3 from March. That's 7 days, 1 week. That's a week count. We count in weeks, and you're expected to get to 40 completed weeks. Term is from 37, 42 completed weeks. From that time, baby is matured, and then from there you can go ahead and have your baby. So we are looking at the first 13 weeks, all right, or 3 months. So when it starts is when the pregnancy is confirmed, all right. Majority of people who are severe there in this hall got pregnant from assisted conception. It was not natural. So we know when pregnancy started. If it was a natural conception, then we will have to depend on your last menstrual period to be able to, let's face here. You're welcome, sir. Your wife is already here. When a man is coming like that, you know that wife has already come out. So for those who got pregnant naturally, you have to depend on their last menstrual period to be able to calculate accurately when they saw that period. Sorry, how old the pregnancy is. All right? And a lot of women are able to tell when they saw that period. First day of the last menstrual period. Some ever be pregnant. But for those who got pregnant through assisted conception, you know when the baby was pregnant. So it's easy for us to calculate. So we're able to give you a more precise date. The dating of your pregnancy is more precise because you know the beginning of the pregnancy. And usually 2 weeks after transfer is when you do your pregnancy test. All right, and you are confirmed pregnant. And then 2 weeks after that, you do your first scan to determine viability, clinical viability of the pregnancy. All right. Now, by the time you are doing your first scan, ladies and gentlemen, you are already 6 weeks and 5 days pregnant. By the time you are doing your first scan, you are already 6 weeks and 5 days. By the time you are doing your transfer, you are already 19 days. You are already ahead by 19 days compared to the person who is getting pregnant naturally. So when you come in for your test and you do your test after 2 weeks, that pregnancy is not 2 weeks old. That pregnancy is 2 weeks plus 19 days. Confusing, Abi? They'll say, what are you saying, doctor? You mean? So now, some people now are just wondering, so my calculation has been very wrong. So that's how. So when you're coming for your first scan, that's why when we do your first scan and we measure, you see we are measuring 6 weeks. You understand? Meanwhile, in your mind, you are thinking that you are just 4 weeks. No. When we had the transfer done, you are already 19 days. Let me explain to you. The baby we transfer to you is already 5 days old. Because we transfer babies that already have been dividing and culturing, and on the 5 is when we do the transfer. So that baby is already 5 days old. And remember, we are assuming it's a 28-day set. 14 days from when you saw your last menstrual period is when you normally will have ovulated. When the baby will not begin to fly. That's already about 19 days. So when you add 19 days to when your transfer took place, you can determine how old the pregnancy is. However, when you come for your antenatal class, just let us tell you how old your pregnancy is. Don't begin to calculate your brain. People's brain will just begin to just say, that's all right. So That is it. So some pregnancies, for those who will get pregnant naturally, they may be unaware that they are pregnant. But like I said before, because most of us here, pregnancy was through assisted conception, you would definitely know when pregnancy occurred. All right. Now, how do we confirm pregnancy? The pregnancy, some people, before you even confirm pregnancy, they already started having symptoms. Now, some people, before they even come 2 weeks after for their pregnancy test, they already know that they're pregnant because all the symptoms of pregnancy are all over. Particularly if you are carrying more than one. All right, the symptoms are much more if you are carrying more than one. And when you come for your pregnancy test, we do the blood test. You can actually do the urine test at home. But some people actually do those who cannot be patient. Let me check. This is doing it. Can't wait to check and then okay, I'm pregnant. They don't pretend as if they've not done anything. They will not come. They are test already. All right, so you can either do that at the blood test or the urine test to check if you are pregnant, and that's confirmed chemically that you are pregnant. Okay? But unfortunately, chemical pregnancy does not always translate to clinical pregnancy. That is why there is so much rejoicing and celebration when we say, congratulations, you are pregnant, with a blood test. The actual test that actually confirms that this pregnancy is viable is the scan that you do 2 weeks after. So now I've entered some. Those who have not done their scan now, they say, hey doctor, what are you saying now? Don't worry, have faith. You will be confirmed clinically pregnant. All right? But I just want to say that this transvaginal scan that is done on 2 weeks after your pregnancy test is what confirms clinically pregnancy. And what it also does is to determine the number of babies you are carrying, because for most of our patients, we transfer more than one embryo. So a lot of times we expect you to have either 1, 2, or 3. It confirms the number of babies you're carrying. It also confirms where the pregnancy is, because unfortunately for a very few category of people, they may be pregnant, but the pregnancy is not inside the womb. Oh, can a woman have a ectopic pregnancy through IVF? Yes, it is possible. But this one we will discuss it as we go on later on in other subsequent classes. All right? So in the first trimester, it's important to know that some people may have no symptoms at all, but yet they are pregnant. Is the pregnancy doing well? Oh, yes. Doctor, I'm not vomiting. I'm not vomiting. I have my friends, all of them. Not everybody will vomit. Not everybody will feel tired. Not everybody will feel strong. Not everybody will have irritation. Not everybody will have mood swings. These are all symptoms of pregnancy. But some people may not have it. Some may have it later on in the pregnancy, while some may have it early. Like I said before, some people's symptoms can come up very early, even before they even have their pregnancy test done. They started having all of those symptoms. And again, some of these may be as a result of the number of babies they are carrying. Because the more the number, the more of those symptoms. And what are these common symptoms? You have nausea, vomiting, tenderness, weakness, you have tenderness, increase appetite. The others you need to have abdominal cramps, bit of spotting in the vagina, mood swings, and you have a change to smell and taste. So if you have a bit of spotting during the pregnancy early stage, some even have even before they have their test done. It's an early sign. It will be transition. Not to worry. Yes, mild cramps possible. Not to worry. Or if it's becoming quite severe, then you need to come to the hospital. What we normally advise is that please make sure you are well hydrated. All right, take a lot of fluid. Because when you are dehydrated, then you may begin to cramp. Okay? So it's very important for women when they're pregnant to make sure they are properly hydrated. And so I'm seeing a couple of people who have bottled water that they're taking. All right? And then it's good for you to make sure that you are taking a lot of fluid. What is the amount of fluid that is recommended? 3 liters in a day. So, this can I just borrow this? This is 75 cl. That means 4 of this you are supposed to consume in 24 hours. Now, estimate in your mind whether you have passed that exam or not. All right? So, it's important, just ensure you are properly hydrated. Okay? And then, what are the other symptoms? Frequent urination, excessive salivation. I don't know what's happening to my wife. Oh, hey, everything, chop, chop. It's pregnancy. All right? So, it's something that some people may have. All right? May have excessive salivation. All right? What is needed is that just make sure you are taking enough fluid. All right? Some have asked, what can I use to stop it? Sometimes you cannot really stop because you're pregnant. But what you can do to help it, you can use, some have used sweet, some have used bitter cola. For bitter cola, what I say, don't chew bitter cola. Just put it in your lips. Just that putting it there and just sucking gradually. Just keep your mouth dry. All right? It's something that usually occurs in the first trimester. After the first trimester, most times it will stop. However, a few categories of women, special women, it does not stop. It continues until the baby comes out. Then the woman is set free. Okay? Right. So, to continue with the symptoms and signs, in the late first trimester, you can begin to have some abdominal swelling. Particularly if you are carrying more than one. Usually in the first trimester, you don't expect your stomach to be big, except of course if it was already other things. When you now get pregnant, it will just show. You see that first trimester, late first trimester, it will begin to show. But if you are carrying more than one, imagine a woman who is carrying. By the time you are 12 weeks, it's like somebody who is 20 weeks. So, and people will be thinking, this one you have gone far. Inside you know that far where. You know where you are. Alright? So, you may find. So, what are the other things? So, usually a transvaginal scan is done as early as 6 weeks to pick up the fetal heartbeat. That is why we do the first transvaginal scan 2 weeks after you have been confirmed pregnant. Okay? And particularly when you do that, you notice that you can pick the heart rate. Once you pick the heart rate, that confirms fetal viability. However, when we do that scan, there are a couple of possibilities. The best one is the fact that you see a good sac, you see the baby inside the fetal pole, and then it's the fetal heartbeat, and a machine can pick up and you can hear the sound. Confirmed. However, you can also see a sac, and then you see the fetal pole, and then you're not able to pick the fetal heartbeat. Once you see that, it begins to raise some issues. Okay, what is happening here? What we normally do is that we don't just consider that all is done well. We give another 1 week. Alright? Because sometimes the pregnancies may not be growing as it should, but it's not a good sign, I must say. Normally, usually, the first scan done after 2 weeks should be able to identify fetal heartbeat to a transvaginal. If it's an abdominal scan, yes, you may be able to. So you may have a pregnancy with a sac, a fetal pole, or no heartbeat, which is most of us. You may have a fetal sac, but no baby inside. That is called blighted ovum. Or you may do a scan and not see anything at all. The uterus is empty. That is either chemical pregnancy or but I believe God has called. That will not be our portion. Okay? So the symptoms of pregnancy may be significant, all right, in the first trimester, or it may be mild. What makes it significant depends on the woman. One, it depends on if that is her first pregnancy, because most women, their first pregnancy are usually full of a lot of, right? Or if they are carrying multiple pregnancies. Okay, if they are carrying more than one, then they will have exaggerated signs and symptoms. For example, excessive vomiting. Excessive vomiting is normal in pregnancy, but there is an excessive vomiting that what we call hyperemesis gravidarum, where you are not able to tolerate anything at all. Anything that goes in, come out. In such situation, that patient has to be admitted in the hospital. You need to be given some injections to stop her from vomiting, and then dehydrated, all right, to be able to manage such a patient, all right. Then, during the baby begins to grow, it's very important for us to know that the first trimester is the most important time where fetal growth is key. All the formations of the organs are all during the first trimester, between the 5th and the 8th week of pregnancy. And that is why we normally will say, make sure by all means, if possible, avoid any medication, apart from the ones that you are giving, folic acid, and other medications to support the pregnancy during the first trimester, because that is the most critical phase of the pregnancy, when the baby is forming all the organs. Because some medications are not safe. They are toxic. And when you take it at this critical phase, it will go and harm the baby. Alright? For those who go to IVF, you know that you are pregnant. There are some who don't know they're pregnant until they get pregnant. Without taking some medications that may not be too good for the baby. Alright? So it's expected that there will be the baby will grow well. However, in 20% of all pregnancies, the baby doesn't grow well. So what happens? The process is terminated and you have a miscarriage. That is the way it is. But as much as 25% of all pregnancies that start does not end up with a healthy baby, because it's not a perfect sign. And once the baby is not forming well, for whatever reason, the body is meant to stop. Then, unfortunately, you will have a miscarriage. So when a woman has a miscarriage in the first trimester, most times a result of abnormality of the baby, for the growth and development of the baby. So while it is very unfortunate, we also counsel and comfort our patients to say, see, it's better for you to have a miscarriage than for you to have abnormal baby. All right? But again, that is not our work. Not our work. Now, what are the threats? So, like we said before, 25%, 20%, 25% of all pregnancy will end up in miscarriage. So it's actually after you have successfully gone through the first trimester into the second trimester, you now begin to say, I have made it. Then that second trimester, I consider it as the cruising phase.
You know what's called cruising phase? When you take a flight, the two critical phases in the flight is take off and landing. Once the plane has gotten to the altitude that is maintained, call it the cruising altitude. At that time, the pilot can even come out from the cockpit and come out gisting with the passengers and put the plane on auto flight. They will just be going on its own. Second trimester is the cruising phase. First trimester can be very turbulent for a lot of you. Third trimester, now you know that you are pregnant because of the weight. And if you are carrying more than one, it's much more. Then the couple, the patient, the woman begins to talk, when am I going to do that? I can't continue anymore. In fact, when is the date? I say, calm down. You're almost there. Alright? Because of all. So, the threats are just that, what I just explained, that the fetal many we've done the cervical surgery training, now we start for antenatal care and continue. For those who will do the antenatal care in another facility, we will give you reports to which other facilities to continue with your care. Alright? So please consult your doctor if you must take any other medication or if you're on any other medication. For those who are on antihypertensives, it's very important that while you are on your program, because we have to be aware, and then we may need to change your medication to something safe. Because you may be taking medications that are not safe in pregnancy. Before we do your embryo transfer, we need to change your medications, and then we need to know what other medications you are for those who are probably diabetic, who are on insulin or other oral hypoglycemics. We need to know. Okay? For nutrition, maintain a normal balanced diet that includes fruits, lots of water. Now at this time for some people, diet has changed dramatically. The things they used to love, they love no more. The things they used to eat, they now love passionately. So it can be from one extreme to the other. Well, basically what we recommend is that take a lot of fluid, water, fruits, have a healthy balanced diet, avoid the use of potash. You know those things they use to cook, what are those things? You know them, all those delicacies, for now you cannot dabble. As long as they use potash, you can't use it. For spicy food, it depends. Some women like spicy food. If it is not hot, it can't pass. While for some, they don't want it at all. So I often will say it actually depends on the woman, because no two women are the same. What will fit this woman while she's pregnant cannot fit this one while she's pregnant. So you need to learn as the pregnancy is going on what will be best for you. Okay? What are the other tips? You need to get a lot of rest.
All right? Get a lot of rest. You continue with your luteal support for those who conceive through IVF. And then once you are done with your luteal support, you plan to register for antenatal care. Now, some may have cervical circulation. Now, for us, the policy for us here at the hospital is that all women who are getting pregnant through IVF, we encourage them to have a cervical circulation. Why? Because we just want to just be careful. It's out of the abundance of caution. The woman has never carried a pregnancy before. After 15 years, she finally gets pregnant through IVF. I don't want to test that service with this kind of pregnancy, whether the service is incompetent or not. I'm not just put a sacrilege to be safe. So that is the reason why we normally would advocate or encourage women to come for cervical service. And of course, those who are carrying multiple, those ones is even more important for you to have a sacrilege, because you may have carried one pregnancy before and delivered, no problem. But now you've never carried two, you've never carried three. The more babies you are carrying, the more the weight on the service. And for those who are carrying multiple pregnancies, it becomes more important for them to have the cervical surface. And that at about the 12th or the 13th week of pregnancy, when you are just ending your first trimester. And at this point, we will say congratulations, and we wish you well in your second trimester. Register for your antenatal, and then we continue. Thank you very much. Time for questions, if there are any. Yes. Circlage. Cervical circlage. It's a stitch. We'll take that topic sometime during our antenatal classes for this year. Lot. It's a stitch that is put around the neck of the womb of the woman, the cervix, and tied. It's just to further fortify the neck of the womb, to make it, to keep it closed. Because in about 5% of women, the cervix opens before time. The woman will be in the 20 weeks pregnant, and the cervix just begins to open. It ruptures her membrane, and the baby just comes out. So because of that, we don't want to wait. And the only way you can make that diagnosis is if this woman has that history. Now, a woman who has never been pregnant before, she doesn't know whether she has it or not. And to make matter worse, she's not carrying two. That woman needs a cervical circlage, just in case. And so that is why we put circlage for all of our women. Yes, for all of our women, for them to get, when they get pregnant, at that 12 to 13 weeks of pregnancy. And then it is taken out at delivery. Again, because most women will have a cesarean section to deliver. Again, that again is a policy that we, for us here, we recommend delivery by cesarean section for women who get pregnant through IVF. You ask the doctor why. Now the reason why we do this is that for us it's safer. You take a woman who has been trying to get pregnant for the past 15 years, after she has done a lot of IVFs and now finally gets pregnant. By the way, a lot of women, more than 50% of women who go through IVF, by the time you go through their history, they don't qualify for vaginal birth. It's either they've had surgery, mectomy before, or they've had previous years before, or they are hypertensive. There are risk factors that makes vaginal birth riskier. And just for purpose of safety, just to make sure that we are in control, just okay, pick a date and we'll deliver you. That is why we offer vaginal birth. But if I see a woman who has delivered before, vaginal birth, no issues, she has had 1-2 deliveries before, and she says, no, doctor, I want to deliver vaginally. If she's carrying one, though, I may allow. which is carrying 2. 1 second. For us, it's more of safety, okay, to ensure that we are in control while we are carrying on. All right. Yes. Questions? No questions? Okay. Yes. There are a lot of reasons why a woman carrying twin, when you say it's not growing, is the baby alive? That one that's not growing, is it alive? Because sometimes we may have a set of twins. These are the options, these are the possibilities that can take place. You can have 2, heart can stop beating. Stop. Or it may not be growing as much as the other one. All right? If they have separate placenta, it may just be either due to genetic factor or the flow of the blood supply and all of those things. Okay? Sometimes it may be one placenta that both of them are sharing, and one of them will be more dominant than the other one. Okay? If one of the babies succumbs and dies, if it's in the first trimester, no problem. That's what we call vanishing twin. We started with 2, one vanished. It didn't actually vanish. Baby stopped growing, the body started absorbing it, the fluid reduced. By the time you deliver that baby, you see that it's just small tissue that you will find. If it happened in the second trimester, that would happen, but when you deliver, you definitely will see the second sac there. If there are 2 separate sacs, then it doesn't affect the other baby. So you can have the fetal demise of one baby in second trimester, and you'll be able to carry that pregnancy on and deliver the baby that is healthy. But that will require more close monitoring to ensure that everything goes well. Okay? Glucose, in what form? The glucose solution. Yes, sir? During pregnancy. Okay, so for the first question, can a woman take glucose during pregnancy? Yes, you can take glucose. It depends on why you are taking the glucose solution. If you are hungry and you are feeling hypoglycemic and you want to take glucose solution, yes, you can take. The amount of sugar in Fanta or Coke is much more than any one that you find in the glucose solution. Except, of course, if you are diabetic, which means that your body already has a challenge with processing glucose, then you have to be very careful. You can't take refined glucose, and that's why certain foods you cannot take, because once you take it, it shoots up your blood glucose. All right? Yes. And then what you can do to prevent jaundice. Okay? So the first thing you do is to make sure you know your blood group, your blood type. All right? There's nothing much you can do in utero to prevent jaundice from occurring, but because of your blood type, you can prepare and anticipate jaundice when the baby is born. For women who are rhesus negative, all right, what we try to do is to make sure we prevent sensitization. So when you're doing even for women who are coming in through for their IVF, we already know what your blood type is, because that's part of what you do as preparation for your program. So if you are rhesus negative, we make sure you do your test, your Combs test, to be sure that you have not been sensitized, and then we give you Rogam to make sure you are not sensitized. And then when the baby is born, then you are also giving that injection. The cause of jaundice in pregnancy is physiological, meaning that baby is born, baby has excess of bilirubin because of the breakdown of Park cell, and the baby is not so mature to take care of it. So what you do is to use phototherapy, and then baby is able to cope. Other than that, prematurity, if baby is born prematurely, again, baby is not still equipped to take care of the excess blood breakdown. And so we're able to manage. And of course, blood group incompatibility between you and your spouse. So all of those things, and of course infection, the other things that will cause jaundice. But during pregnancy, there's nothing much. Okay, the other thing that they also will say that don't use camphor. You know, some people, when they want to preserve food their clothes, they go and buy camphor and put it. Don't put it on baby's clothes. All right, because they said that chemical can cause jaundice. All right, you don't use camphor at all. And if you have used it, go and wash the clothes. So that smell will be off. Okay. All right. So, any other question? No. Okay. So, okay. To feel. Yes. Now again, positioning for line can also be a challenge. All right. We normally advise women to lie on their left side. All right. Particularly when they're in their late second and third trimester, because the left side is a side where if you lie, it does not impede the flow of blood through your vessels. However, you can also lie on the right, whether left or right. Sometimes when you lie on one side for too long, you begin to feel pain, particularly on that side that you have laid on for a long time. And what you do is to change position. And based on how you lie, you may begin to feel pressure or heaviness on one side of your tummy. That is why we say for women who are pregnant, you can't use two pillows. Get a lot of pillows, 5, 6 pillows, so that you can support. And then when you are sleeping, your husband should not be sleeping. Your husband should be watching over you. So that when you are turning in your sleep, in your dream, the husband can help gently to adjust you very well. The men are say, doctor, I have to go to work to make money. All right, so that is it. But yes, heaviness, pain, bit of discomfort is something that you feel while when you lie down, particularly in the third trimester. All right. So no? All right. So I want to once again, on behalf of the team, questions. Oh, okay. For those who are online. Oh, that's true. Okay, so we'll quickly just take some questions because I'm needed in the theater right now. I told them that please they should just wait and let me finish this class first with this precious patient before I get into the theater. So let's just take. Can we have the question on the screen? So this class will be taking place every month. Please don't miss it. And you can also invite your friends, even patients who are not registered patients of the JOJE hospital. They are free to come. It's a service we are offering to everybody who is pregnant. We want to empower women with knowledge so that they can be in charge of their reproductive process. Okay? And to also say that this is a hybrid session. It's both physically here and they're online. So if you are in any part of the world, you can actually join and be part of this class. All right? The question. Okay, read them out. Yeah, water and first trimester, it can be an issue. And some people, yes, so that is a very legit complaint. So what you can do, for those who have difficulty taking water, you can mix it. You can mix it with either Ribena or something. Just change the taste. It helps. Okay? Just plain water may not pass. But if you add something to it, then it helps you to be able to take the water. Okay? So it's very important. And what you just be sipping, you can't just gulp at once. No, just be sipping. Just to ensure that you are hydrated. Next question. Bleeding. Say bleeding? For the past 7 days. Bleeding in pregnancy is not normal, no matter the amount of days. All right, so now the question I want to find out is first of all, how many weeks is she? What's the stage, the gestational age? 2, what is the amount of bleeding? Is it spotting or is it bleeding? All right, all of these questions will help to be able to make a diagnosis as to what is happening. Because bleeding in the first trimester and bleeding in the second trimester are not exactly the same. The volume of blood that is being lost also matters. All right, but it's not normal. What our advice is that you get to the hospital and see your doctor. Next question. I've answered that question. That question is not for these pregnant women. They are not. This one, she has missed this. Pawpaw and pineapple. You can take pawpaw and the pineapple. I don't see there's no restriction for pawpaw and the pineapple. Ripe pineapple, ripe pawpaw, pineapple. You can take it. It's acidic. Yeah. Sweet, ripe pineapple. It does. No, it's not. It's not acidic. It's not acidic. You can take it even in the first trimester. You can take it. You understand? For Ishewu, so they use potash for Ishewu. That's all. Hold on small. Hold on. Next. At what point is it safe for a woman to deliver if she's carrying multiple births? Safe in terms of the baby, I presume. Well, once a woman has crossed 28 weeks, yeah, you can deliver, and then there's a chance that the baby will survive. But typically, we expect that above 34 weeks, because that is the age of fetal maturation. Because one of the major problems of the maturity is respiratory distress. And so once you are above, the woman is above 34, then she can go ahead to deliver. But we will not deliver you at 34 weeks deliberately, because you have crossed 34 weeks. Because apart from the fetal, from the lungs maturing, we also want to make sure the baby also acts with, maybe the birth weight is increased. All right, so typically for, like I said, the period of delivery for 10 pregnancies from 37 completed weeks to 42 completed weeks. That's for single thing. For women who are carrying twins, we can get to 37 weeks, some 38 weeks. But from anything from 37 weeks is fine. 36 weeks, if delivered, baby will be fine and will not be in the incubator. 35 weeks, maybe just some observation. All right, 34, 35 weeks. Anything less than 34 weeks, the baby will require some assistance because the lungs will not have been matured. All right? Okay. Carpal tunnel syndrome. That is what you are having. And what that means is that there's fluid in the spaces. So you find it difficult to do like this. And when you are carrying something, you may want to drop off from your hand. Very painful. Yes, it's normal. You just have to manage, and they probably use some tight bandages to tie, and then do exercise. But after you have delivered, then you go back to normal. Okay. Oh, okay. The person you come and register for antenatal. And then we will not give other antenatal medication that the patient can take. That patient has finished with her support. She has done circulate. She's only having folic acid. Let her come and register for her. And so that should be one of our patients. All right. But of course, the normal prenatal supplements, pregnant care, they come in various varieties, from the simple to the sophisticated. What is most important when you are pregnant is iron and folic acid. All the other vitamins, they are all Jara. So most of them are found in our multivitamins that are given. All right? Okay. Very what? As long as it contains folic acid. You understand? Their pregnant care contains folic acid, contains iron and other multivitamins. Okay? So you can take that in place of the folic acid. All right? Folic acid, as long as you have 400 million kg of folic acid, you are good. Okay? No problem. I know she's a patient. I know she's a patient. But that is our protocol. From the way she answered the question, I know that woman is following our protocol. Okay, I think this woman has been putting up her. Okay, are they still? Well, let's just take from the in-house. No problem. Our own policy here that we give 2 doses in each pregnancy. You understand? So we give 2 doses, and if you get pregnant again, we give 2 doses. Because if we want to do that 5-dose regimen, you will not be able to give the 4th and the 5th one. The patient has already delivered. So you just do 2. It's able to protect while you are pregnant and after pregnancy. Then when you come again, you are pregnant, you just take it. That's the policy we have here. Okay? Oh, okay. Yes. Fluid. There's fluid there are some spaces inside your tissue that those fluid will enter, and it will not be irritating your nerves. Yes. Once you are pregnant like that, there's fluid that enters into your extravascular spaces. Blood, fluid, the fluid. And the only remedy is after pregnancy, you have to stop. Yes, normal. That's why when you are pregnant, constipation is common in pregnancy. So that's why it's also important for you to know what kind of your meal. So make sure you take high fiber diet, a lot of vegetables, a lot of fluid. Okay. Some women have that problem naturally, even without pregnancy. And when they are not pregnant, it becomes worse. Sometimes you may need to help if it becomes really bad. But if you have stooling question is like, can you go without stooling for 2-3 days, right? Yes. But when you are stooling, is it hard? Afterwards, after that 2-3 days. When they come out, yes, it's possible. Just to make sure that you increase the amount of um, vegetables you're taking and fruits. Okay. Okay. It helps you. Fantastic. So maybe you can also follow that experience. By the time you do watermelon and add that small lemon, I don't think the acidity will not be much really. Cold water. You take cold water and ice block. Really? Huh? I can pass your throat. If it's not cold, you can. It is safe, no problem. No, they used to say that if you take cold water, the baby will catch pneumonia. It's not true. It's not true. So you can take cold water, no problem. The water is not going to the baby, it's going to your stomach. There's no relationship between water in your stomach with baby. Okay? For the men. It's okay. Whichever way, whichever temperature you want it. Whether cold, hot, or room temperature, it's fine. No problem. All right? Any other question? No? What is that? What is it? Uzu. So how do you use it? You don't chew it. You swallow it. This uzu, say it contains, what does it contain? Potash, abi? It's clay. And clay contains a lot of potash now. No, don't chew it. Just put it in your mouth just to help stop it. Don't chew it and swallow. I think they are calling me. All right, so I want to. Oh, there are still more questions. 28 weeks. Right. This question, there are two ways. 28 weeks, you can take Rogam if you are rhesus negative. All right? Or fetal lung maturation for those who got pregnant through IVF. And we do that prophylactically to hasten the maturity of the baby's lungs, just to ensure that just in case baby comes before time, the baby stands a better chance of survival. That is done at 28 weeks. Okay? Next question. There are so many causes of waist pain during. It could just be a sign that the baby you're trying to miscarriage, particularly if it is associated with bleeding. All right. It could also be that you're carrying multiple pregnancy. It could also be that there's fibroids. All right, or adenomyosis, or infection. It could also be that you have malaria, you're having fever. All right, so there are so many things that can cause you to have pain, waist pain, and it could just be perfectly normal depending on the intensity. All right, but if the pain is very severe, it's making you very uncomfortable, and you come to the hospital. All right. So this thing they call hotness of the stomach. For doctors, it's very difficult to diagnose what is hotness. And what most times what patients consider as hotness is pain. Pain. All right? You're having pain in your stomach. Is it during pregnancy? Did they say during pregnancy? Yeah, so it's the same thing about the causes of pain in pregnancy. So it's to evaluate you and to know what the challenge is. In fact, okay, I failed to mention something else. UTI, urinary tract infection. You can have a burning sensation. All right, passing urine will be difficult, as well with pain and their frequency. That can be a cause of pain. And sometimes what people may consider as hotness may be associated with some psychological disorders. Yes. So when you are saying you are feeling hot all over, crawling sensation, it means that you need your mental health needs to be checked out. You are going through a lot of stress. All right? There are no pathological conditions associated with it. You can see that this, okay? Okay, you came late, so we talked about vomiting. When you're vomiting in pregnancy, there are medications you can take. It just will help to stop it for a while. Okay? The reason why you're vomiting when you're pregnant is because of the pregnancy. And it varies from one woman to the other, depending on the number of babies you're carrying and whether it's your first pregnancy or not. But when it gets too much, you have medications to help with it. When you hold chicken. And when did that start? Okay, so you need to go and see the doctor. It could be that maybe you're having malaria. You know, when you have malaria, you have general body pain. So you feel malaria recently. Are you working too much? Your work is stressful. Okay. But and are you taking paracetamol? So I take paracetamol and see the pain will go. Different things. Yes. Yes. It's not a funny question. It's a very important question. Okay. Since November. So that question, I need to know how many weeks your wife is right now, because this is the protocol. When your wife is, after the transfer, nothing. When she gets pregnant, nothing. After she gets to three months, when she has cervical septic, nothing. Until she gets to about 26 weeks, about 5-6 months. If she's up to it, and if she wants, then. So if you calculate 6 months, so when the journey started, that would be about 8 months. If it was November, the journey started, so maybe around May? Is it May? Or June? That is when likely. It's too long. I understand. I agree with you. It's too long. But you see, you need to, it's a sacrifice. It's a sacrifice. Just sacrifice for this period. And so that nothing can go wrong. Well, that matter is matter that we can discuss. So when we are discussing about sex in pregnancy, I think we'll delve into that one some more. Okay. All right, so now, see, wait, they are waiting for me in the theater. The baby needs to get into the room. So the questions that we couldn't take now, let's note it. When we have our next antenatal class next month, we'll start with those questions. All right? I'm sure there are many. Yes, and we can't exhaust all the questions now because we are really, it's already past 4. So We're really behind schedule. I need to get to the theater. So I want to apologize for those who we couldn't take their questions, and to thank most profusely all of our esteemed clients, those who came physically and on ground here, and those who are joining online, to say thank you very much. And I want to, once again, on behalf of the team, wish every one of you a very smooth, uneventful antenatal period, and then to have a safe delivery. Please make sure you attend these classes every month. We're going to be coming up with different topics just to empower us.
Alágbára kábíyèsí ẹlẹ́rìí ọba alábí àsásí abiyamọ títa tí wéré elédùmarè ọba tó ga jùlọ foundation tó solé ayé ró foundation ìgbàlà mi mo dàgbé kọrùn fún bàbá tí ìṣèkẹ́ mi kábíyèsí ọlọ́run mi alágbára agbára ọ̀rọ̀. kábíyèsí ẹlẹ́rìí ọba alábí àsásí abiyamọ títa tí wéré elédùmarè ọba tó ga jùlọ foundation tó solé ayé ró foundation ìgbàlà mi mo dàgbé kọrùn fún bàbá tí ìṣèkẹ́ mi kábíyèsí ọlọ́run mi alágbára agbára ọ̀rọ̀ dáhùn alágbára kábíyèsí ẹlẹ́rìí ọba alábí àsásí abiyamọ títa tí wéré elédùmarè ọba tó ga jùlọ foundation tó solé ayé ró foundation ìgbàlà mi mo dàgbé kọrùn fún bàbá tí ìṣèkẹ́ mi kábíyèsí ọlọ́run mi alágbára agbára ọ̀rọ̀ dáhùn alágbára kábíyèsí ẹlẹ́rìí ọba alábí àsásí abiyamọ títa tí wéré elédùmarè ọba tó ga jùlọ foundation tó solé ayé ró foundation ìgbàlà mi mo dàgbé kọrùn fún bàbá tí ìṣèkẹ́ mi kábíyèsí ọlọ́run mi alágbára agbára ọ̀rọ̀ táwọn alágbára kábíyèsí ẹlẹ́kùn.
Covenant keeping God, I worship you today. Covenant keeping God, you can never ever change. Covenant keeping God, I worship you today. Covenant keeping God, you can never ever change. Covenant keeping God, I worship you today. Covenant keeping